Welcome to the Transformation Institute's podcast for change. Here is our host, Omari Jahi Aton.
Hey, welcome everyone to the Transformation Institute podcast for change. I'm your host, Omari Jahi, and we're here again, and we have a special guest with us tonight. We have the number one physician in the city of Chicago, Dr. Sonya Oyola. She's going to be here tonight. Well, not going to be. She is here with us tonight, and we're going to be talking health is wealth. That's the topic for tonight because we do believe that health is wealth. It's very valuable. It's right up there with air. Let me see you live with bad health. Just like with air, you can't live without it. So with that being said, I want to introduce my co-host. You guys know who they are. They're here every week. My girl, Vanessa, Miss Kim, and my man, Will. We all here in the building, and we about ready to get started. I'm going to introduce our special guest, Dr. Oyola. Sonya Oyola has been, oh, wait a minute. I got real high tech, y'all. I have a, what they call it, a screen monitor where I can read her bio off the screen. Y'all can't see it, but I see it. But anyway, Sonya Oyola has had the privilege of being a family medicine physician since 2000 after completing medical school at the University of Illinois College of Medicine in 1997 and training at Cook County's Family Medicine Residency in 2000. She completed the Andrew Weil Integrative Medical Fellowship in 2013 and is currently the director of the medical student education for the Department of Family Medicine and co-director of the ambulatory clerkship and also the assistant dean for health equity and inclusion for the Pritzker School of Medicine at the University of Chicago. She sees patients as an integrative medicine consultant and primary care physician at the new UC site at 55th and Cottage Grove Avenue. Her specific interests are in integrative primary care, domestic violence, stress disorders, mind-body medicine, meditation, yoga, and breath work, and culinary medicine. In 2009, she founded a nonprofit organization called Be All Right, which supports survivors of the domestic violence in Chicago area domestic violence shelters. She has complete training in level 1 and 2. Who are the love of her life. Also, Dr. Oyola was recently named Best Primary Care Doctor on the Chicago Reader's Best of Chicago 2024 list. So please put your hands together for me and for us and welcome.
Hi, everyone.
Good evening.
Hello.
So nice to be here with everyone. Thank you so much. Thank you so much for inviting me to spend time here with y'all.
Well, thank you for joining us tonight.
Y'all. Can y'all hear me?
Now we can.
Hello?
Yes. Yes.
Oh, y'all, everybody can hear me?
Now we can. Yes.
Yes,
Oh, okay. I think my internet was being crazy.
I think it's because
Dr.
of the storm.
Sonya, thank you for being here. Welcome, welcome, welcome.
Thank you so much. It's my pleasure to be here.
Thank you for taking out time to be on this podcast. We know you're a very busy doctor, and we're the one of the main questions I want to start off by asking you is your interest is in integrative primary care, domestic violence, stress disorder, all of those things that we spoke about in your bio. Can you touch on that? Why it is that you wanted to specialize in that?
Absolutely. Thank you for that question. And I would say that I first could describe integrative medicine. Some in integrative medicine is the combination of conventional medicine with complementary medicine. So conventional medicine is the medicine that we know here in the US, very commonly prescribed medications. For example, if you have high blood pressure, you might go to a conventional medicine doctor and get a prescription for a medication like a hydrochlorothiazide, for example, to bring down the blood pressure. What integrative medicine is that it would, to add to that conventional medicine, you can add complementary medicine. And examples of that would be, for example, how nutrition can be your food, can be your medicine. Movement is your medicine. Herbs and supplements, vitamins, your stress management, techniques like mind-body medicine, breathing techniques. So all of those other what's called complementary medicines combined with conventional medicine is called integrative medicine.
Oh, okay.
And so integrative primary care, what it means is I'm a primary care doctor, and primary care doctors, what we focus on is prevention. We focus on helping individuals and families prevent those conditions, chronic medical conditions like diabetes, hypertension, even depression, chronic pain. But at the same time, also if the person has those conditions, help manage those conditions with the patient. And the focus is really around preventative medicine.
Mm-hmm.
And so integrative primary care would be, I'm a primary care doctor who approaches the care of the patient in an integrative fashion. So with that kind of thinking, kind of holistic thinking of not just it's conventional medicine that's going to support and help this patient and family, but how do all of the different types of medicine together help support this individual and family as they're either preventing their disease or treating their disease.
Right. Now, there's not a lot of doctors that, well, maybe I just don't know, but you're kind of like the only doctor. Most doctors, they specialize in well, I wouldn't say specialized, but they're kind of the traditional primary care. They don't get into herbs. My doctor, I ain't gonna say her name, but my doctor, she ain't asked me nothing about, I take herbs myself, but she ain't asked me about herbs. She suggested any herbs. So see, the devil is a lie. We're gonna get through this podcast. Why would you think that
entirely? I'm sorry.
I understand the devil's messing with this because this is gonna be a really good podcast, but we're gonna fight through this. But I guess the gist of my question is, why do you think that there are a lot of other primary care physicians like yourselves that focus on homeopathic remedies and things of that nature? Hello? Could you?
I think everyone is freezing tonight due to the storms. A lot of areas have storms going on right now.
Oh, wow.
I think that's interfering with the internet, the broadbands.
And the devil is a lie. She'll be back. She'll be back in a minute, you guys. So just hold tight. And for those that are listening, if you want to ask questions, like the last 30 minutes of the show, we're going to make sure that we address any questions that you put in the comments or in the text or the chat or whatever. Ask her your questions so that she can address some of those questions as well. Here she comes back now.
Okay.
All right, we're back.
Yes, we're back.
Well, we're hearing there's a storm out. Yeah, we're hearing it's a storm out, so it's probably interfering with the internet.
I think so. I think you're absolutely right. Yes.
Yeah, but we're going to forge through and get.
Oh yes. Oh yes.
Yes, yes.
A little bit of rain is not going to.
I guess the gist.
Oh no, the Wi.
We're losing.
I think the Wi-Fi is not helping us out tonight.
Yeah.
I think the Wi-Fi is not helping.
Well, while we're waiting for Tyrone to come back, you mentioned something about one of your areas of studies or concentration about the mental health and the alternative to the I forgot it was the medicine that you need, the other things that you can use along with the medicine that you've been subscribed to. So what I would like to know, as far as with the mental health, I need to learn how to meditate, and you know how you need to take a minute for yourself.
Mm-hmm.
So can you talk about that? How one person can just take a minute, block out everything else, and just learn how to breathe, in a
Mm-hmm.
sense.
Mm-hmm. No, I love that question so much, and in many ways that was exactly why I got interested in the first place in integrative medicine, because I was working at the Catholic Charities
Hmm.
on Elston Avenue, across from the Juvenile Correctional Center, so many years ago, and there were people that I have been meeting that were under extraordinary amount of stress. And one of the first questions that I had were for them was really, how do they, how do people manage stress day to day? What do we do? And in general, what I discovered was, what do we do? We'll shop, we'll eat, we spend a lot of time on our phones, or spend a lot of time watching videos, or to
Hmm.
decompress, right? To
Hmm.
take that minute to ourselves and disconnect. But and there's no judgment on any of those things, because if you have access to that, that's what you do, and that's what it is. But I started becoming very interested in other techniques to help people manage stress. One of them you mentioned is breathing techniques. A breathing technique. There are so many, but one of the most common breathing techniques is breathing into a count of four and out to a count of four, and into a count of four and out to a count of four, and imagining that really you're kind of following a square as you're doing that. And so into a count of four, and then you move across and out to a count of four and into a count of four. Another breathing technique is something called the 4-7-8 breath, where you breathe into a count of four, you hold it for 7 counts, and then you breathe out to a count of 8. And what's been discovered with that kind of breathing pattern is that if you breathe out a little bit longer than you breathed in, it stimulates something called the relaxation response. And we've got two types of responses in our body. We've got a stress response, or the flight or fight response, where if we see something alarming, we freeze. We might fly, right? We might fight if the alarm comes closer to us. And then actually the fourth part of that response is pretending we're not alive. And so that 4-part response is called the stress or the flight or fight response. But we have another response called the relaxation response, which does just the opposite. It helps us. Our breathing starts to slow down. Our blood pressure goes down. Our pupils dilate so we can see more. And in that deep sense of rest, what has been found is there are certain exercises that can help you tap into that. To your point about the moment that you take for yourself. So if you're under a lot of stress, you could take a moment to sit and do one of these breathing exercises that'll help you exercise the relaxation response. And in many ways, the way that I explain it to patients is that it's not that the flight or fight response is the bad response and the relaxation is the good response. They're both necessary for survival. They both are necessary, because if we're in any kind of immediate danger, we do need to activate the flight or fight response. But when we're not, and we should be able to activate the relaxation response. But what happens is that as we're living day to day, and we're under enormous amount of stress day to day, either because of the images we see, the stories that we read, the information that we're learning that's very, very stressful, our jobs, our driving, all of the things, relationships, this flight or fight response gets very strong. It's very strong. It's like a muscle that's been exercised and it gets very, very, very strong. So it's the first thing that can turn on pretty easily. But the relaxation response, which hasn't been naturally activated day to day or moment to moment, is not as strong, and so it doesn't activate when we need it. And so what happens is that our bodies are tense and we're in this tension and fight or fight mode, and very little relaxation. What happens with that is our blood pressure goes up, our blood sugar goes up, so we develop hypertension, we develop diabetes, our muscles get tense, so we get chronic headaches. We get tension in our stomach muscles too, and so we might have constipation or diarrhea. And so too much of any one response is going to set the body out of balance, and the body is going to start to develop all these chronic conditions. So to your point about taking that minute for yourself to relax is such a great question, so important, because the more we take that minute to stimulate or activate that relaxation response, the more we practice that, the stronger it's going to get. And then there will be a better balance between the two. This one won't be stronger than the other. Actually, they'll both be as strong, and they'll both activate according to the activity, according to the task that we have at hand. And that greater balance in the body helps to prevent those diseases or those conditions that I just mentioned, hypertension, diabetes, anxieties, depression, chronic pain. And I'm not saying it's all on us to just do this and it's all going to magically go away. It's our environment that is leading to these stressors. So it's not about just an individual like just doing this and that's the answer to it all. But that's the part or the role that we could participate in to mitigate or to offset some of the external stressors that are coming at us no matter what, right? Like this is, it's so hard to control what's coming.
Right.
But what we can do is modulate how we respond to it. And that way to respond to what's coming has to do with whatever has been practiced, on the regular. And I always say it's not about perfection. It's not about doing this all the time. It's just about doing it when we can. And even a little bit makes a big difference in how strong that relaxation response turns on. So I love your question. It's so important to take that time, that minute, to say, okay, how do I center myself? How do I stay right here in the present moment? Do I do a breathing exercise? Do I meditate? Though the differences between a breathing exercise and a meditation is that a meditation, you sit and you're paying attention to the present moment. And as your mind starts to wander and you start to think and ruminate and overthink, you call it thinking. You say that's thinking. It's thinking. And what you do is you try to bring your attention back to the present moment, like a baby, like how you would treat a baby. Where'd you go? You're so sweet. Where are you going? Just come on back here to this present moment. And the more we do that, more we befriend ourselves and we're compassionate with ourselves. And that's called mindfulness meditation.
Okay.
Now, some people, it's not for, meditating is not for everyone. So for example, for folks that have been acutely traumatized and they have a lot of flashbacks and they're remembering their trauma, a meditation is not something that I would necessarily recommend, because if you're in your own mind, you may remember and you may have a lot of flashbacks. So for that person, it might be better to do a breathing exercise, something really physical. A walking meditation might be better, where you're paying attention to your feet as you're walking, versus just sitting and trying to manage the thoughts. Because again, if you've been under acute trauma, that might bring back a lot of memories and a lot of flashbacks. So not everything is necessarily the best thing for you. It's just about where you are and what you need. Those two are examples of what's called mind-body medicine. What I just described, a breathing exercise and a meditation are what's called mind-body medicine. And there are all kinds of different types of mind-body medicine as well beyond those two. But those are the two very common ones that are practiced.
All right. Well, thank you. That's very informative.
Of course, my pleasure. Thank you for the question. Thank you.
I'm Black.
Hey, Omari, you're back. I'm so excited.
I don't know what happened to you, Vanessa. I fell out for a minute, but I'm Black. I don't know what. This is just getting crazy. But let me just ask you one question before they knock me out again, real quick.
No problem, of course.
What was it? It was based on all of you and what you do. There I go.
It's the storm. We're going to call it the storm Wi-Fi.
Oh my God.
It's Mother Nature. You know, when Mother Nature takes over, it's so humbling because us little humans on this planet, we think we got some control, but then Mother Nature says, no, actually, I tell you what to do day to day.
Right. No, but I guess, can y'all still hear me?
Yes.
Oh, okay.
Yes.
I thought I was gone for a minute. Okay. But what I wanted to ask was based on you being a physician. When people come, or when people go looking for a physician to become their doctor, what would you suggest that those people should look for in order to pick the right kind of doctor for them?
What a wonderful question. My goodness. Well, I would say that what we know more and more is that someone who is what's called linguistically and culturally concordant to you, in other words, someone that shares your culture, someone that shares your language, your health outcomes actually are much better. So I would say really being aware of that is important. That may not be the only factor that you use to make that decision, but it's a very important factor to recognize. You know, patients that, you know, I am a native Spanish speaker, you know, from Colombia, and my entire career has been in working in communities that both speak Spanish and English. You know, I grew up on the west side of Chicago in the Austin community, and so I connect very much with the Black community. I connect very much, especially as an Afro-Colombiana. You know, my mother is Afro-Colombiana. You know, she's right on the coast of Colombia. And so being from that culture and having grown up in the Austin community on the west side on Long Avenue, like I connect very much with the Black community, but I also connect very much with my Latin roots. Because at home, we spoke Spanish, we cooked, you know, arroz de coco, you know, that's coconut rice. And so I can really connect well culturally with patients that have those similar backgrounds. And when you connect culturally like that and linguistically, you're better understood. You're really, you know, I think even more, there's a stronger advocacy also, I would say. And there's an accuracy, I would say, in the clinical diagnosis that is really harder to achieve when you don't have that kind of connection with people. And so I would say if someone's looking for a new primary care doctor, think about, you know, where they're from, you know, what kinds of experiences have they had as a human being? You know, where did they grow up? Where did they train? You know, who have they been working with all of these years? What kind of community organizations they work with? Do they have a mission around working with people that have been minoritized? You know, do they have this work in their heart, or is it, you know, because if that is something that is important to you, you seek that, and then that way you're going to really be much more connected with your primary care doctor, because the medicine only really happens based on a relationship. The relationship is actually what catalyzes the medicine. The relationship is the vehicle for the medicine. Without a relationship based on trust, mutual understanding, mutual respect, mutual seeing, ooh, the medicine, it does not work as well. It really does not. And that's just the truth. Um, and I'm not trying to say that you cannot connect with somebody that's of a different culture. You certainly can, but maybe your connection could be mission alignment, right? Value alignment, right? And so that's so important, I would say, to really, really get the kind of care that we deserve, that we all deserve. Mhm. I know it was Omari's question, and he's not here.
I'm back.
You're back. You're like the disappearing that. You're like the disappearing man. You're like a magician tonight.
Well,
You're a magician.
yes, but I'm back. Hopefully, I'll stay back. I don't know, but if anybody in the audience had a question for Dr. Sonya, we'll address a couple of your questions. Unless anybody in the panel, any of my co-hosts, you guys have a question for Dr. Oyola?
I had asked a question while you were out pertaining to breathing methods, and she
Yeah.
mentioned meditate. So I asked my question, which was a good response. I appreciate that.
Thank you so
Okay.
much. Thank you for asking. Yeah.
We'll
You had
definitely practice that.
You had some for Will? No.
No,
Will?
I like the analogy to relationships, because I look at the choosing your primary doctor as a partnership,
That's
because
right.
that's kind of how I view health, is like a partnership. You got to have a strong partner to help you make it through the finish line of life, if you will.
100%.
Yes.
100%. Beautiful analogy. That's exactly right. So the relationship based on equanimity, we are both experts. No one has more expertise than the other, just different expertise. Yeah, different sets of knowledge. And then when that knowledge comes together, wow, then it's a transformative new
Right.
answer together. So I 100% agree with you. That's definitely how it can become and be helpful care. Mhm.
Right. Well, one of our viewers asked the question, is the 10-second rule still valid today?
Oh my God.
So when things fall
Oh.
on the floor, I love it. I love it. Well, I would say it just depends on what fell. sometimes, my goodness, it's like, how do I let that go? How do I let it go? I gotta wash it off a little bit.
Right.
No, all jokes aside, if it fell on the floor, it is safer for you not to consume it, because you don't want to eat things that shouldn't be in the body. And there are a lot of chemicals and a lot of substances on all of our surfaces actually that are not safe for the body. Even the cleaning supplies that we use for the floor are not necessarily safe for our bodies to consume. So, yeah, all jokes aside, it's probably safer for you to just go ahead and say goodbye. Say goodbye to that little French fry.
Right. Okay. So, let's see. No, I don't have any other questions from anybody, but
I have a question.
Go ahead, Vanessa.
And it kind of feeds back off of Kim's question to you. So, and you breaking down everything to Kim's question, I just wanted to know what you feel about like the tests that they have out now, the lifeline screenings for heart health. And do you think that's something that we should really consider, especially if we have like a history that may give us heart disease or strokes or possible heart attacks? And I'm asking because I had a TIA a few years ago, and it was based on high blood pressure and uncontrollable anxiety. And I did some of the things that you mentioned, but now I'm seeing a lot of things saying this lifeline screening may be effective, because having a major stroke is one of my concerns. So I want to know what you think about like the lifeline screenings that they're promoting right now.
Thank you for that question, Vanessa. And my apologies that I don't know exactly would you be able to describe what is involved with the Lifeline screening? What are they testing for, like blood sugar, cholesterol?
I believe it's the diabetes screening, high
Mhm.
blood pressure, cholesterol. Plus, they're doing a test
And
that
also-
tries to make sure that your carotid artery isn't showing any signs of plaque and everything. So it
Gotcha.
seems like it's expensive, and
Mhm.
I'm wondering if it's worth it because that is a big concern for me.
Of course, a wonderful question. Thank you so much. And you're right. A lot of times, screening tests, or tests in general, are being packaged, put together, multiple tests in one package, and labeled in a particular way, and to offer that to a patient to screen them for heart disease, for what's called blockages in the arteries, or the risk that you may have blockages in your arteries, either in the neck or in the brain or in the heart or in the kidneys, in the legs. That's called vascular disease. Vascular disease, when there's plaques in the arteries, vascular disease. And vascular disease can occur in any one of those parts of the body that I just mentioned. Um, a full package of tests that looks at diabetes, looks at cholesterol, looks at checks the blood pressure, looks at the kidney function, liver function, and is even doing some kind of imaging studies like an ultrasound, looking at the arteries in the neck, or what's called the carotids. Who should get that? Who should get that? Should everybody get that? Should some people get that? First and foremost, there is an organization called the U.S. Preventative Services Task Force. And what this organization does is it looks at all of the research involving screening or not screening individuals. You screen a population in general if the prevalence of the condition is high. So let's say hypertension, very, very common in our country. We should screen for that. Everyone should be, every adult should be screened for that, and child should be screened for high blood pressure because it is that prevalent. But the reason why we also should screen for it is because we have a treatment for it. So you should never screen for something that doesn't have a good, reliable, accessible treatment, because then you screen for the disease, you discover it, and you can't offer anything helpful to the patient to treat it. So in this circumstance where you're describing this whole set of tests to screen for vascular disease, I would say the individuals that absolutely should get a screening. Your situation is a little bit different in that you've had a TIA already. So your testing would be more what's called diagnostic. In other words, you've already had this condition, and now what we're trying to do is discover if there's more blockages in any other part of your body. You should have that. Absolutely, yes. You've had a TIA. You should make sure that you've had full tests looking at your heart, your kidneys, the brain. And when I mean the brain is our carotid arteries, to make sure that there aren't plaques there, or even an MRI of the brain to see if there's any vascular disease in the brain, okay? But for a person that has never had a TIA, has never had any symptoms, that is the person that goes through a screening. So screening tests are for people that have not had any symptoms, okay? So you screen them to see, could they have this condition? And so the people that should be screened with that Lifeline test that you've described would be people according to risk. So people that have a family history of diabetes, people have that family history of hypertension, people that are overweight between the ages of 40 and 70 should be screened for diabetes. People who doing a regular ultrasound of the carotids is not something that's been shown to be used as a screening test for people that have never had symptoms. But for someone who has had symptoms like yourself or the condition, absolutely you should have a carotid ultrasound to look at the state of your carotids, right? To see if there's any worsening of those plaques, for example. But people who have never had symptoms, have never had the condition, and you're trying to look to see if they may have the condition, that's the group that should be screened. And it's 40 to 70-year-olds that are overweight that should be screened for diabetes. And in men, 45 or older for cholesterol. For women, 55 or older for cholesterol. Hypertension would be any adult. All adults should be screened or checked for high blood pressure, okay? So it depends on the age. It depends on the weight status that we do some particular screening tests. It could be that there's this, it's being packaged in this way. And for individuals, I would say, that have a strong family history of heart disease and fall under those categories that I described, that package that you described sounds very reasonable to do.
Okay,
Cool.
thank you. I
Of
did
course.
just look it up. So in addition to the carotid artery, they screen for abdominal aortic aneurysms, atrial fibrillation, and peripheral arterial disease.
Okay, so thank you for that description. So for aortic aneurysms, abdominal aortic aneurysms, the research on that is that it's for everyone who has smoked at least for 20 years should have one-time ultrasound of their abdominal aorta to see the size of that aorta, because if it's too big, it could actually bleed, okay? And so that's a one-time screening for that group of individuals. So in other words, that's not a package of testing that should be offered to absolutely everyone. It's specific ages, weight, risk factors like smoking that put you in the category of being screened for those conditions. So, but you know what? To be honest with you, whenever I see packages like that, what I get concerned about somewhat is that, you know, we are in a sick care system. We're not in a healthcare system here in the United States. And really, the sicker you are, the more the machine, so to speak, of sick care makes money. And so we have to be really, really careful to almost not fall into the pattern or usage of this process or the system without really, really good, clear evidence that it is for us, that it is specifically for us. Because I get concerned when it's packaged like everyone should get this, that for many people it's actually not for them, and that what will happen is that they'll get tests that are unnecessary, that will show things that were, for example, falsely positive. You know, so these tests are also not perfect. So you get a test, let's say, that is not necessarily exactly for you, and let's say the results come back positive, but actually it's a false positive. Now you have to get the next test, and the next test, and the next test, and you may actually end up with a procedure that you never needed in the first place. So that's why it's so good to speak to William, what William was reflecting on, that partnership with someone who could really break down every single one of those tests that you have listed in that package to say, does this make sense for me? Does this make sense for me? Does this make sense for me? Has the research shown that this would be helpful for me, me individual, with what my blood pressure is, my age, my weight, my family history, my other medical conditions, me, you know, and we're moving in the direction of personalized medicine. We're moving in the direction of making medicine more specific to individuals and not doing kind of these kind of blanket recommendations for everybody, because you do end up then doing tests that may be unnecessary, and that leads to more worry, more anxiety, more, okay, now this test came back positive. And imagine a test coming back and it's positive and it wasn't truly positive. And imagine now that you have this positive test in front of you and No one could really explain it, right? The anxiety that leads to too. And I'm not trying to say these tests are not valuable. I'm saying that they're valuable with a lot of thoughtfulness and a lot of specific thinking for that individual, versus like, okay, let's all run out and get this package, you know? But I think every individual test that you mention is absolutely can be a very, very valuable test for a person who's trying to make sure that they do not have heart disease or cardiovascular or what's called peripheral vascular disease or vascular disease, right? But plaques in the arteries. It just really has to do with whether they have that risk factors for it in the first place.
Mhm. Okay.
I hope that makes sense. I hope that makes sense. That's just a lot of information, but I just want to like share with you how I would share it with my patients. Do you know what I mean? Like how I would break it down, because my patients do come to me a lot too, saying like, should I get this test? And I saw on TV that now they're offering this new medicine, and I saw, you know, on this ad that they're offering this other thing, the scan, the body scan, they're getting all the tests. And what I say is, let's sit down, let's look at the test, let's see how it's been tested, let's see how sensitive it is, you know. And sensitivity means that when you take that test, when it says it's negative, you can rely on it, you can trust it. High sensitivity means that 95% of the time when it is negative, you can trust that answer. But there are a lot of tests out there that have a very, very low sensitivity. And so, in other words, let's say the test is 50% sensitive. You can only rely that it's actually negative 50% of the time. That's not a test that you want, because that's like flipping a coin, you know, and then you may end up getting the wrong side of the coin that wasn't true. That wasn't true. So that's why it's so important to like, you know, it's like, okay, here are all these tests, here are all these offerings. I'm reading about this and the other thing, and working with someone to really break down how these tests are sensitive or not, how they've been tested or not, and whether they make sense for the individual or not.
Now, Sonya, I heard you say something to the effect of medicine is moving in a certain direction.
Yes.
You know, so with this new emergence of AI, is AI
Yes.
being filtered into medicine in some kind of way? And what is your opinion on that?
Yes. Thank you for that question. I mean, I think what I would say is that for every technology, there can be great benefit, but also potential harm, right? For any new technology that comes along. Here's where I can see the harm. Where I can see the harm is in no longer trusting ourselves. And here's an example of that. This phone that I have right here. I know how to get to certain places. You know, I know how to get to certain places without using this phone.
Right.
But I will put in an address. Today, I put in an address to a shelter to deliver an air conditioning unit. And I know how to get there. I know how to get there. But I put it in my phone, and the phone took me the longest way you could imagine. And I thought, really, I could have left, turned right, gone up the street, 10 minutes later, been there. It took me 20 minutes to get there. And that's because I did not rely on my own knowledge. Okay. Right. So I think that is a very important thing to recognize, that as soon as we start adopting a technology that we feel is more reliable and trustable than our own experience and knowledge, that could potentially cause harm, you know? Now, where it could cause a lot of benefit is that, let's say I already know how to get there. I know how to get there. I have it all mapped out in my brain how to get there. But I say to myself, you know, I wonder if there's another way to get there. And I use this technology and I look at it and I say, no, actually, my way was the better way. Or I look at this technology and it says the same thing I thought. Then I'm like, okay, you know, that awesome. I thought of that and they thought of that. So I got the answer. That was the answer, you know? So I think really understanding that we have to rely on our knowledge very much, and not stop increasing and improving on our own knowledge, because once we do that, the machine itself is also not perfect. AI is also not perfect. It may give you then a wrong answer. And if we don't have that already innate knowledge that we're just checking in on, if we don't have that innate knowledge and we're just relying on the technology and it gives us the wrong answer, then we've given the wrong answer to the patient. Okay.
Beautiful.
So I think the other way that it can cause a lot of benefit, though, is, you know, for years and years and years, when I first trained so many years ago at County, we just had pen and paper, you know what I mean? And I would just sit in front of, that's why I'm such a slow medicine doctor, because I don't do anything fast, I'm telling you. I saw a patient last week at 90 minutes with the patient. But so when I sit and when I first started engaging with technology, what happened was that I spent my time here on this computer, and the patient would be over here on the side. So the patient became almost a side member of this interaction, right? Like, and what does that happen? If you're not facing the patient and you're not making eye contact and your shoulders are not square with the patient, there's less of a connection. That's just by default. There's less of a connection. Just like if you were trying to have a conversation with somebody, and let's say you're on the phone and you're talking with them there, and maybe they start looking sad after they said something, but you don't know if they looked sad or not. You don't know if they started looking a particular way. You don't know if they look uncomfortable because you're here, you know? So what I think AI can be brilliant at is, you know, it's a scribe, right? So it can listen to the conversation, record the conversation, and then write that note out that you would double check. You would check for its accuracy. Yes, if that is what the patient said, that is what I said back. So now the note writing is freed up. So what can happen now? I can actually turn and be with that patient, and talk with that patient. And, you know, here's this technology that's collecting all that data for me that is going to write that note, and it frees you up to be with the patient again. I think the other benefit it could have is that whatever data we put into AI is how it's going to actually create the most accurate diagnosis. So, you know, what's also disappeared over time is the physical exam. When's the last time you went to the doctor and they actually did a real, like, thorough physical exam? Sometimes you don't even get your heart listened to, or your lungs, and I'm not trying to say that we need a head to toe exam every time. We should be focused in what we examine based on what the patient is presenting with. But we've lost the skill of the physical exam, many of us. And so if you don't put in an accurate physical exam into your data, you're not going to get an accurate diagnosis. So I think what it's going to do is going to help us get retrained back and being actually accurate physical examiners, so we can actually put the right data into the AI. Because it's not just the history that's being collected, it's actually the physical that we also capture and we put in. We also heard this in the lungs, we saw this in the eye, we felt this in the neck, we saw this in the shoulder. And when we don't have the accurate information put in, we're not going to have an accurate diagnosis. So I think it's going to help revive the patient-physician, patient-health provider relationship, because it'll help us be more connected. And then it'll also make us more accurate physical examiners, again, to create an accurate diagnosis. So I think there's a lot of benefit there. We just can't say, like, okay, now I don't have to think.
That's great. Yeah.
So I have to think, so I have to research. Yeah.
Well, we have a couple of our viewers that had questions about supplements.
Of course.
What would your recommendation be one young lady said she doesn't take any medication. She just does supplements. What is the best supplements for a young African American woman? And another one was asking about beets. What is the best beets supplement would you recommend?
Oh, wonderful questions. I love those questions. First of all, as an integrative medicine doctor, I have had more training in the use of supplements. And in many ways, what I learned so many years ago was that if you are deficient in a particular vitamin, if you are deficient in a particular mineral, that needs to be supplemented. Now, why are we deficient in the first place? We're deficient often because our food sources are not rich in that nutrient, or we don't have access to that nutrient. We don't have access to that food source. Okay. So an example I can share is that many children growing up on the west side and the south side of Chicago, because of a lack of healthy food sources, may be very deficient in iron, for example. Iron deficiency. And iron deficiency leads to anemia, and anemia leads to fatigue, poor concentration. It leads to inattentiveness. Now, notice those symptoms. They may sound like something called attention deficit disorder, ADD. Right. But really what those kids have is a deficiency in that mineral, okay? Now, do those kids need to be supplemented? Absolutely, yes. You know why? Because we're not going to wait until they have, of course, we should improve our nutrition sources, our food sources. Food is medicine, 100%. I'm a huge food is medicine person. I've been teaching culinary medicine at the university for 10 years now. But we know that those kinds of changes don't happen overnight, and they take a long time for communities to have access to those sources. So in the meantime, when you think about someone who is coming to you and has those kinds of symptoms, inattentiveness, a lack of energy, distractibility, instead of immediately saying, okay, this child has ADD and starting them on medicines for ADD, we could check to see if they have a deficiency, a vitamin D deficiency, an iron deficiency, potentially even calcium deficiencies, because maybe they don't have access to rich calcium sources. And then if there's a deficiency, supplement that. I think right now we're in this culture of like supplements are good, but that's not automatic. That's just like the test. That's like just saying like all tests are good and I should get all the tests. No, is the supplement right for you? Is the supplement necessary for you? Do you have a deficiency in the first place? And it's so important to know if there's a deficiency, because let's say the supplement you buy over the counter isn't the right dose for the kind of deficiency that you have. You may be convincing yourself that I'm supplementing, but that isn't even touching your deficiency. Not at all, right? So it's good to come in, have that conversation, get tested for these deficiencies, and then be guided as to the types of supplements that would be absolutely necessary. I love the question around what would be the supplement for a young African-American woman. I would say for women, for African-American women, and for women in general, the most common deficiency is iron deficiency, because we're menstruating, right? We're menstruating, we're losing a lot of iron every month in our menstruation. And if we don't have a rich iron source in our nutrition, we become iron deficient. But if you do not have an iron deficiency, taking iron without that deficiency is not helpful, and in fact can be harmful. Too much of a supplement can be harmful. You can start storing up excess iron. That's not also good for your body. Not good to have excess iron. So again, for a young African-American woman, the most common kind of deficiency would be an iron deficiency because of menstruation. And the common symptoms of an iron deficiency would lead to something called anemia, and anemia would be easy fatigability, low energy, low mood, depression, feeling sad, feeling blue, feeling lethargic, feeling weak, feeling short of breath. When you're walking, suddenly you get easily short of breath. That's because you're not having enough oxygen going through the body to help you with that activity. And that can be because of anemia. So let's say that young person doesn't have any of those symptoms, but they have very, very heavy periods. Very reasonable to go in with your doctor and say, hey, you know what, I have super heavy periods. I want to make sure that my iron is okay, that I'm not becoming iron deficient. Because you also don't want to get so bad that now you're having to recover from like a really, really, really low iron. Like it's good to be ahead of it, right? To say, like, I could potentially become iron deficient. Let me check on that, make sure I'm not, so I'm ready and I can take rich food sources that will help me with the iron, like beans are a great source of iron. Greens are a great source of iron. It doesn't necessarily have to be meat right away. There are a lot of really rich plant sources that are great in iron right off the bat without having necessarily go to meat, but certainly red meat is very rich in iron as well. So for that question, I would say iron is a thing that I would check. The other very common deficiency is vitamin D deficiency, and especially in folks of color. Absolutely. Because of our absolutely amazing color, our melanin, we need to be out in the sun longer in order for our skin to make the same amount of vitamin D than a person that is not of color. Okay. And actually 30% of our body has to be exposed to the sun and at a particular time of the day for us to make enough vitamin D for the day. So we have vitamin D deficiency. This is very, very common. And vitamin D deficiency can also lead to feeling really tired, feeling depressed. Actually, your immune system gets weaker too when you're vitamin D deficient. You catch the cold easily. The COVID is much more intense when you're vitamin D deficient and you have COVID. So that's the other vitamin that I would say is so common that I would check in on to make sure vitamin D and iron. Those are some of the two most common. There are many that I can also think of, but depending on symptoms, if they have a particular symptom. If they're not having any symptoms at all, those would be the two that I would have on my mind to make sure that they're not struggling with.
Now, is there a beet supplement that you would recommend?
Wonderful question. You know what? I would have to, there's so many brands out there, and I would say it depends on what someone is trying to use it for. The most common reason for using a beet supplement is for hypertension. Because beets lower your blood pressure, and just naturally eating beets will lower your blood pressure, but beet juice can lower the blood pressure. Beet juice better than beet supplements, because supplements are dried out plant sources that if they've been in a capsule and they've been dried out and they've been sitting on your counter for months and months, that's not going to be as potent as taking it fresh or taking it in a juice form. Okay.
Oh.
Now it's easier to take a pill, but it's not as potent, As similarly like garlic, garlic supplements, they're not as potent as really fresh garlic cut up. You wait 10 minutes so it can become the most potent. Because if you cut it and you let it sit for about 10 minutes, it reacts with oxygen and it becomes really potent at that time as what's called an anti-inflammatory. And that's when you would consume it. And you would cook with it at the very end. You don't cook it first because you don't want to denature it. You don't want to eliminate its potency. You cook and then you add the garlic at the very end to leave it as fresh as possible. Then you consume it. That is how that becomes a medicine. That garlic becomes a medicine versus like a dried out garlic in a capsule that's been sitting in your cabinet for a few months, So beets, I would say beet juice, natural beets, those are, if people enjoy that. Now people sometimes just don't enjoy having garlic or enjoy having a fresh beet. And so they're like, I'm gonna take a beet supplement, and that's fine. That's what you can do. Just know that it just may not be as potent, but it depends on how it's made. And so what I would recommend for a reliable source, and I can put it here in the chat. There's a website called VitaCost, and I think it popped up. Yeah, VitaCost is one of my favorite websites for looking up high quality supplements that are affordable. The other, if you want to look at the quality of a supplement, there's another organization that's a nonprofit organization that's been around for over a decade now. It's called Consumer Lab. And what Consumer Lab does is it tests all these supplements to see what's the highest quality supplement. Because you may buy that beet supplement, but let's say capsule to capsule, it's a different dose. Each capsule is a different dose because it's not regulated, right? So what Consumer Lab says is there consistency in every capsule? And is there a consistency in what the capsule has inside of it and what's labeled? What's on the label, okay? And Consumer Lab is nice because it also gives you a chart of all the supplements, and it looks at the quality, manufacturing practice, the quality, and it also looks at the pricing too. So it gives you a range of prices for these products too. A very fast and easy way to know, a faster and easier way to know if a supplement is a high quality supplement is there should always be a manufacturer listed. There should always be an expiration date. On the label, there should be details about, like, for example, if you bought a beet supplement and all it said was beets, that's not a high quality product. It actually has to identify the active constituent or the active chemical in the beet and list that out and list that by percentage and dosing. That detail is what's going to help you affirm that what exactly you are consuming. If it just says beets, there's no reliability around what that is. So manufacturer name, expiration date, and the details of that plant, the part of the plant, the active constituent or chemical that they've extracted to help with that condition, that should all be listed on the label. And if you see a product that has Consumer Lab on the label, that has a little Consumer Lab sticker, it's been studied by Consumer Lab, that's a high reliable product. The other is if you see USP or United States Pharmacopoeia, if you see that on the label, that's a high quality product too. So there's ways of just like, if you didn't have access to looking up, these products, to just pick up a bottle and say like, is this likely high quality or not? Through those methods, you can have some better reliability about the quality of the product. Okay.
We have a few final questions.
Of course.
Let's see. Well, Yolanda, and this is my wife, Yolanda.
Hi, Yolanda. That's so good. She should come on the Zoom with you right there.
Yeah. Well, anyway. But she asked, is the watermelon diet good for everyone? She knows. Yeah, she knows that it's a trend, but and she also said we probably need a part 2 to this conversation.
I love it. Okay, so I'm not as familiar with the watermelon diet. My apologies for that. And part of it is that I'm not one of these folks that recommends for people to start a particular diet. I'm more of a person that really assesses what a person is consuming day to day, what they're used to eating day to day, and noticing how, and together brainstorming about how to tweak that diet to make it more healthy and better achieve the goal that they want to achieve. So let's say somebody with high blood pressure and they're just like, what diet should I start for my high blood pressure? Now, in the example of high blood pressure, there's something called the Dietary Approach to Stopping Hypertension diet, or DASH diet, that's been studied for years now. It was studied 35 years ago. And it's still been shown to effectively lower your blood pressure if you start something called the DASH diet. It'll decrease your first number, what's called the systolic number, the number that's usually in like 140, 160, right? That's called the systolic number. It can decrease that by 12 points within 2 weeks of starting the DASH diet. The second number, called the diastolic number, which is usually in like 70s, 80s, 90s, right? That second smaller number, that's called the diastolic number. And it can decrease that by another 6 to 8 points within 2 weeks, okay? So that DASH diet is something that I would say, like, and I wouldn't recommend it in this way, like start the DASH diet. No, I wouldn't do that. What I'd say is, like, how do we make your food more DASH-like? How do we move the way you eat regularly, leaning toward more DASH-like? Because I think it's not, to me, what I found over the years of trying to teach culinary medicine is that it isn't as helpful to patients. I don't believe, and I haven't seen, to say start this diet. It's just not as helpful because, first of all, do you want to eat that? Is it accessible? You know how to make that? Is it a part of your culture? Is it, for example, like starting the Mediterranean diet, like saying that on the south side of Chicago, let's start the Mediterranean diet. Like, what are we talking about here? That's not a part of the culture to talk about starting a Mediterranean diet. Now, there are principles of the Mediterranean diet that any kind of pattern of eating can adopt that will then make that pattern of eating more healthy. Okay. Mm-hmm. So if we tweak the diet, that makes it, that can help. So for example, spaghetti and classic spaghetti and meatballs, classic spaghetti and meat sauce. Now you can use regular beef that's, let's say, 70% lean. There's a lot of saturated fat in that, with just a tomato sauce and onion and a white pasta, right? A semolina pasta. If you start to take out some of that meat and add some lentils to add for protein, or add some vegetables to that sauce, you've already started to tweak that. It's still going to be as delicious, but what's happened is half the calories are reduced, half the sodium has now come down, your saturated fat has come down. So you're taking a dish that you love and you enjoy, and you've made small adjustments, and it's just as delicious. And now it's going to help you with your blood pressure, and it's going to prevent the diabetes, treat the diabetes. So to your question about the watermelon diet, I always get a little concerned when a new kind of diet trend starts to happen that says, and my apologies, I don't know enough about the watermelon diet to really be able to share it with you, but I'm thinking that what it means is that the focus is eating watermelon or eating that instead of something else, or focusing just on eating watermelon for part of the meals or the whole day. Sometimes what we're doing is we're eliminating a whole category of foods, and we're saying, okay, if I've eliminated all my carbs, if I've eliminated all my fat, like all the carbs would be the Atkins diet, for example, right? When we do that and we eliminate a whole category of foods, it's sort of like eliminating a whole category that can be as helpful to us and is so necessary for us as humans, right, to thrive. So we need a little bit of all three of those categories, but each individual person here on this call needs it in a different way, in different percentages. Maybe for Sonya, I need for the fat, because it's fat, proteins, and carbs. So maybe for Sonya, I need a little bit more fat and less carbs and more protein. But actually, for William, it needs a little bit more protein, less fat, and more carbs. So that's also changing how we're talking about diet. We're knowing more and more that for each individual, those categories are specific and should be thought of in a tailored way. But I would say for the watermelon diet, if it's eliminating everything except for eating watermelon, you're going to lose weight, certainly, because, that doesn't have a lot of calories. But what I'll say is that, and so you will feel like, okay, if your goal is to lose weight and you're only having basically water all day, sugary water all day, you certainly potentially could lose a lot of weight because that has less calories than eating like a steak with rice. You know what I'm saying? But at the same time, you're losing a lot of nutrients. All of the other nutrients that you would have gotten from those categories you're not consuming. So you could be losing weight, but not in a way that's preserving your nutrition. Because there's a difference between high calories and low nutrition and high nutrients and low calorie. And watermelon essentially has lots of calories, but actually doesn't have a lot of nutrients. Because all it has is sugar. So actually, when you're having watermelon, your blood sugar, it's like having a cup of juice. Your blood sugar is gonna go up pretty quickly because there's no fiber. There's no fiber in the watermelon. Your sugar's gonna go up fast. It's gonna crash fast. You're gonna get hungry quicker, and you might end up eating a little bit more because you're hungry. So, hey, what I say is, you know yourself best. You know what you need best. You know intuitively where you might start feeling a little bit tired or weak or foggy brain, that okay, maybe this is not for me because it's not really supporting me.
Right.
And at the same time, if you do it for a short period of time because you wanted to lose some weight and that was your goal, it's just not a sustainable thing to do for the rest of your life. Sure, you might lose 10 pounds within the couple weeks, but are you really going to be able to eat watermelon and only watermelon for years, or for the rest of your life? You're not, right? And so you're going to end up eating again and eating like you used to, and sometimes overeating. And the body, what it does, because the body never wants to lose weight. Never, 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 never. The body wants to keep weight because that's the way that it preserves itself. Like all of this, all of this is like keeping me safe, right? So the body wants to keep it. Now, if it loses it suddenly, what often happens is it rebounds and it says, "Oh, you lost. You must be in danger. What's happening? You better regain and gain even more to protect yourself." So there's a lot of yo-yoing that happens once you try this specific diet and it's just not sustainable, and you go back to your regular eating and you gain even more. So, I say all of that to say, if you're going to start a new, very strict, specific diet, do it with your partner, to William's point, right? Do it with your partner, a health professional that can monitor nutrition deficiencies, monitor your blood pressure, monitor your state of health. And if you're safe and your blood pressure is stable, your vitals are stable, and you're not becoming nutrient deficient, then you could feel a little more comfortable proceeding in whatever pattern that you want to do for some period of time. Mm-hmm.
Well, Dr. Oyola, thank you for being on. I know we're definitely not going to be able to get to all of the questions that everybody wanted to ask, but we thank you for being on, and maybe we can reschedule you to come back again and answer some more questions that they may have.
No, it would be my pleasure, and I'll try. It would. Thank you for all of the questions. They were really, really, really wonderful, very rich, very fascinating, and I'm a pleasure to be here. Absolutely.
Definitely. So if somebody wanted to have you as their doctor, how would they make that happen?
Well, right now, what I would say, first of all, Tuesdays is going to be an integrative medicine day. And so what that is that if you're already working with your primary care doctor or your specialist, and let's say that you're working with them and the conventional medicine that you've been taking has only helped you so far, and you think to yourself, you know what? I wonder if other types of medicine combined with this would help me a little further. I'm still in pain, let's say. I still have these headaches. I still can't sleep. I'm still having these hot flashes. I'm still feeling depressed, and I've been trying this conventional medicine, but it hasn't gotten so far. If you're thinking, I wonder if other medicines combined with that could be helpful, that's called integrative medicine. And on Tuesdays, I would do what's called an integrative medicine consult. And so that would be an hour together to just go over what you're taking, how it can be combined, and an assessment of the mind, the body, and the spiritual health, all three domains, to come up with a plan. The way people can do that is calling the 55th and Cottage Grove Avenue clinic, the primary care clinic at the University of Chicago, and asking to make an appointment with me for an integrative medicine consult. On Wednesday mornings, I am doing primary care. So if you're looking for a new primary care doctor, that would be Wednesday mornings. And those visits are about 30 minutes. And that would be more focused on screening to prevent, as was mentioned, and then also really a good sense of, managing chronic illness, or if you have acute issues that come up that you need some care and attention around. But that's primary care, and that's on Wednesday mornings. So I would just call the clinic and say, you just want to make an appointment with me for either an integrative medicine consult, or you need a new primary care doctor, and I'm happy to be of support in any way. If you're working with a specialist, like I said, let's say you're a neurologist or rheumatologist or endocrinologist, and again, the conventional medicine has only gotten so far, and you think an integrative medicine approach would be helpful, then you can absolutely just make an appointment with me on Tuesday for an integrative medicine appointment. Okay. Mm-hmm.
All right, fantastic. Thank you, Dr. Oyola, for being here. And we're gonna talk some more and see if we can get you back another time so we can really expand on this. Because I even have more questions. Just based on what you were saying, and you're very thorough in your answers. And I thank you for not giving a lot of clinical. I know a lot of doctors, they give you all that clinical terminology. Mm-hmm. We don't know what the heck that stuff means, But you were very clear.
Thank you.
Really
thank you so much. No, thank you for that feedback. That to me is what I think is where I feel the most helpful is, and I think I appreciate that. I definitely want patients to feel completely clear, more clear. Anyway, more clear. I'll say that in a humble way. More clear about their conditions and their options. That's empowerment. That's the power of our communication. Is now people come out more ready to do and decide what they want to do with their lives, and that gratifies me in very, very deep and meaningful ways, for sure.
Beautiful. Thank you so much for being here, and we'll set up a new one where we can come and do this again. So until next week, you guys, we'll see you again. But until then, make sure you continue to think for a change. Take care.
Take care.
Thanks for supporting our podcast. We look forward to see you next Thursday at 8 p.m. We also ask that you subscribe to our YouTube channel. The more subscribers we have, the more YouTube will push our podcast to more viewers. But until then, subscribe also for a peaceful mind. Your activity will reflect that peace.